frequently seen in chronic atopic eczematous dermatitis. This is on the basis of patient complaints as per the history given by the patient. I took these are the subjective parameters such as Pidakas, Kandu, Daha, Ruja, Vaivarnya, Shrava, Rukshata, Raji. Pidakas means vesicles or blisters over the nape of the neck. Kandu, patient was having severe itching more in the time of night time. Daha, burning sensation, it will be there 24 hours. Ruja, that is pain. Vaivarna, discoloration all over the body or affected area. Shrava, discharge in the affected part. Rukshata, in some part will be having dry and some part where discharge. Raji means there were you can observe in the image that in pulpitial area we were having the patient was having the linings, that is the thickening of the skin. Raji means linings. These are the description of patient. Name of the patient Mr. XYZ, age 67 years, gender male, nationality Indian, state Karnataka, district Hubli. Appearance, the patient was moderately built and moderately nourished. Physical and mental disposition was irritability due to itching sensation. The patient was always in a irritable mood. And occupation and socio-economical status, as a patient was a farmer and he was a middle class family. Coming to the complaints. Before that, you can observe here in this image, you can observe that over the Griva Pradesha, the vesicle, small pidakas were started, and over the chest, dryness is there, that is Rukshata. In cubital fossa or pulpitial fossa, you can observe that Shrava or discharge and lines are there along with thickness of the skin. Let us learn what kind of complaints we were observed in that patient. Though these symptoms of Vicharchika, by taking the history, it revealed that patient was a farmer. He was working in the field and he was exposed to various factors such as different kind of pesticides and insecticides in his field. Why? Because he was not taking any precautions. That's why. Why? Because these pesticides and insecticides are known as a cumulative toxic in nature. By this, we can consider this can be or this case can be a Dushi Vishay as a Nidana. Dushi Vishay, already all of you know that. Shivanand sir also in previous webinar, he has been explained about Dushi Vishay, Garavishay, etc. Dushi Vishay is the cumulative toxicity or a slow poison. Immediately you won't get any toxic effect. After exposing to the various toxic substances in different form, inhalation or in direct contact or by consuming, etc. Okay, you will get a Dushivisha type of Nidana. Okay, uh, this by taking this case as a Dushivisha as a Nidana, it may causes Vicharchika. Hence, here we followed the Dushivisha line of treatment in this case, and I got good results also with successful reducing all symptoms. Okay, here history taking is very important. Why? Because we will come to know the various causes or nidanas and manifestation of diseases. In this patient, these pidakas or vesicles or blisters were initially observed over the griva pradesha. Griva means over the nape of the neck in the form of small boils associated with itching sensation since 6 months. Later, patient developed kandu, that is itching sensation, daha, burning sensation, ruja, that is pain all over the body. Along with that, patient was suffering with shrava, that is oozing or discharge from the affected area, shava varna, discoloration, and some part over the rukshata was there. Okay, these are the symptoms we observed in that patient. Along with that, a patient was a known case of IHD and hypertensive since 5 years. Now it is more than 8 years also. He was on treatment. That he was taking clopidogrel A 150 mg OD and Tazlac 40 mg OD. Next, coming to the personal history of patient. Agni was Madhyama, Ahara, Mamsahari, Nidra, Alpanidra, that is due to patient. In Ahara, patient was taking non-veg weekly twice or thrice in a day, and along with that, patient was taking Katu Amla Dravas. Nidra was disturbed due to itching sensation, and he had a habit of taking tea coffee on and off and more than 10 to 15 times. Along with that, patient was having a habit of taking chronic smoking, like one pocket per day, and alcoholism more than 25 years. And nature of work was, as he was a farmer, moderate, due to his age, he was doing moderately manual work, and bowel was clear once in a day and semi-solid consistency was there, and urine 5 to 6 times in a day and once in a night. And coming to the treatment history, patient had taken a oral, consulted modern dermatologist and taken oral and topical steroids like antihistamines, anti-inflammatory treatment for 6 months, but patient had no improvement observed in his complaints. Coming to the family history also, there is no similar history in family. Similar complaints were not observed in the family. And psychological history, the patient was irritable due to itching sensation. Coming to the clinical findings, general findings like general and systematic examinations were normal, but skin examinations, color was hyperpigmented, texture was roughness was there, temperature, warmness was there in the affected area, moisture, both was there. In particular part, it was moist due to discharge or oozing, and in over the part, it was dry. Margins were poorly defined, margins were observed in that patient, and area, whole body was affected with the Vicharchika or eczematous dermatitis, and we were observed the lichenification, that is thickening of the skin over the affected part. These are the parameters I took to assess the Vicharchika after treatment and before treatment. And these are the routine investigations was carried out on that patient. All the investigation reports were within normal limit. Coming to the Ashtasthana Pariksha, Nadi 72 per minute, and Mutra Prakrita, Mala Mutra Jiva, Shabda Sparsha, Drug Akriti, everything was normal. In Jiva, it was uncoated. Why? Because he was not having digestion power is not good. And coming to the Dashavida Pariksha, Prakriti, Pitta Vata Prakriti was there. Vikruti, Dosha, Kapha Pradhana, Tridosha was there. You can observe here in Vichachika also it is Tridosha Javadi. And here Dosha in Vikruti, here Kapha Pradhana Tridosha was there. And Dusha, it is affected to Tvaka. The exposed part was Tvaka, and it is affected to Rakta Dosha, Rakta and Mamsa and Ambu Dhatus. Okay, next Srava, Sara, Madhyama, Samhana, Madhyama, Pramana, Madhyama, Sattva, Madhyama, Satmya, Madhyama, Ahara Shakti, that is Madhyama, and Jarana Shakti, Madhyama, Vyayama Shakti, as he is 67 years old, that was also Madhyama, not too much work he was doing in farm also, little bit. And Vaya Radha. Coming to the Vikruti Pariksha, Nidana. as he was exposing to the pesticides and fertilizers in his farms. I considered this as a dushivisha and viruddhahara, as he was taking continuously uh, katu amla rasa and non-veggies on and off on weekly 3 to 4 times, and mamsa sevana etc. was there. No, and this is the nidana. And purva rupa, it exposed with the Tvakvikara, discoloration and Pidakas and Shrava was there. That is Purva Rupa. Rupa, Kandu and Shava Varna, Srava, Rokshata, etc. was there. Coming to the Samprapti Ghataka, Dosha, Kafa Pradana Tridosha, Dusha, Tvak Rakta Mamsa Ambu, Agni, Jataragni, Ama. Just before I told you, tongue was uncoated, and that's why Ama Jataragni, Dhatvagni, and Shrotas, Rasa Rakta Mamsa. It is affected through this Shrotas. Shroto Dushti Prakara, Sanga, Udbhavasthana, Ama Pakvashaya, Sancharisthana, Thiryagati, Siras, Vektasthana, Twak. It is affected over the Twak region. Rogamarga, Bahya, and Sadhya Sadhyata, Kashta Sadhya. Coming to the diagnosis of this Vicharchika. In modern, already he was consulted with the dermatologist, and they were diagnosed with the atopic dermatitis, atopic eczematous dermatitis on the basis of clinical features. As per Ayurveda, it is diagnosed as a Vicharchika. Uh, they were diagnosed as per their clinical features, but we need to diagnose these disorders on the basis of clinical features, which has been explained by our acharyas like Charakacharya and Sushrutacharya, that is given in different features of Vicharchika. First one is, as per Charakacharya, Sakando Pidaka Shava Bahushrava Vicharchika. Already we in previous slides, our first slide only, we have been observed. Patient was complaining of Sakando along with various complaints. Patient was having Kando, that is itching, Pidakas, that is vesicles or blisters, Shava, discoloration, Bahushrava, that is excess discharge or oozing was there on the affected area. That's why it is considered as a Vicharchika as per our Samhita or as per Charakacharya. Next, coming to the Shushrutacharya, Rajyo Ati Kandu Ati Rujaha Saruksha Bhavanti Gatreshu Vicharchikayam. Means, Rajyo means there were lines. Okay. Ati Kanduhu. Atikandu means severe itching was there. That's why the patient was having disturbed sleep and psychological disturbance was there. And Ati Rujaha, severe pain was there. In Shushrutacharya, special unique feature was Sarukshata. And in Charakacharya, Bahushrava was there. These are the two unique features we can observe in Vicharchika. Both dryness and the moist features will be there in Vicharchika as per these acharyas. Bhavanti Gatreshu Vicharchikana. All these symptoms were observed in that particular patient, and we were diagnosed with a Vicharchika. Coming to the core part of today's presentation, that is treatment plan. Treatment given by me only. First, counseling was done with the patient and patient attender, then suggested for the admission. Then started with the classical Virechana, followed by Shamanaushadis. So, classical Virechana started with Deepana and Pachana for Amapachana, with Chitrakadivati to TID before for 3 days. Next, Snehapana was started with the Kalyanaka Grita. The Kalyanaka Grita we were used for Snehapana. It is indicated in Dushivisha, Garavisha. That's why, and Rudde also. Why? Because in patient is a known case of IHT and hypertension. It is useful for all the multi condition. That's why I chose Kalyanaka Grita here. Okay, that Kalyanika Grita as a Snehapana given for 3 days, that is in the 30, 70, 100 ml only. Why? Because as patient is a cardiac patient, so I have given smaller dose only. Till until that patient got a Samyak Snigdha Lakshana, and we were observed all these Samyak Snigdha Lakshanas. After attaining Samyak Snigdha Lakshana during Vishrama Kala, Sarvanga Abhyanga with Eladi Thaila, we were advised along with Mrudu Svedana was given. Why? Because we need to decide here what kind of Svedana has to be given. And as the case was Dushi Visha, and as the case was cardiac patient, I need to think and I need to give a Svedana also. That's why we need to have a Mrudu Svedana. Okay, that's why I have given Sarvanga Abhyanga followed by Mrudu Sweda was given for 3 days. Next, Virechana was done with Trivrut Leha. This is the best drug of choice for Virechana. That's why I took a Trivrut Leha, that is 30 gram with warm water. And later that day patient had a 10 vegas were observed in that patient, and these 10 vegas are considered as a avarashuddhi. So due to avarashuddhi, I advise samsarjana krama for 3 days along with some shamanaushadhis for 1 month. That is Patola Katuruhinyadi Kashaya 10 ml TID with water for 15 days, and Dushi Vishari Kulika 2 TID with water for 15 days or 1 month. Uh, Actually 1 month I advised. Later Arogya Vardhini Vati, that is 2 BD for 1 month, and Alpamradi Taila for external application. Why I written 15 days here? Because after 15 days patient came for follow-up with complaining of swelling in the both lower limb, as he was a known case of IST. Before I given Virechana, and patient came with both lower limb swelling, I was in a confusion. So I thought, I suggested that patient please consult a cardiologist for further management. And he consulted. There was no any other pathological changes, and he got relief from the swelling over the both lower limbs by their treatment. And later patient came for second follow-up after 1.5 month. uh, that time patient got 60% relief from the all clinical features or symptoms. Next, we advise shamanaushadis for 1 month, such as nimbadi kashaya along with gudichadi kashaya 20 ml along with water, and along with bilvadi gulika 2 TID after food with water. And later we advised ukulu tiktaka grita 15 ml on empty stomach with warm water morning. And later we apply advised nalpamradi taila external application. This nalpamradi taila was there for continuously for external application. And this slide explains about gradual improvement in the parameters of Vicharchika. As before, I told you that I took the parameters like Pidakas. If it is no Pidaka, 0. There is a mild Pidaka, 1. Moderate Pidaka, 2. And severe Pidaka is there, means 3. Like that, I took a parameters. Here, before treatment, Pidaka, Kandu, Daha, Ruja, Shrava, Rukshata and Vaivarnya Raji were there in a parameter like 3 only. After Shodhana, it reduced to mild, not completely. Okay, it reduced to only 1%. The progress of the treatment, how it is reduced to 2, how it is going to reduce to 0, we need to know. The patient was treated with Shodhana as the first line of treatment for any type of kushta to bring the vitiated dosha from shaka to koshta. The eliminated these vitiated doshas are eliminated through virechana, and these shamanaushadis are shamana dravyas having kushtagna Krimigna, Rakta Prasadana, Tridoshagna, Kandugna, Daha Prasadana, Vishagna. Mainly all these drugs are having Vishagna and Tridoshagna Varna. Why Varna is important here? The patient was having discoloration. Rakta Prasadana, why it is needed? It is affected to Rakta Dosha also, or Rakta Dhatu also. And why Tridoshagna Dravyas are needed? As per Prakriti, Vikruti of patient, Tridosha, Kapha Pradhana, Tridosha was there. That's why to reduce the vitiated dosha, Tridoshagna Dravyas are needed. And Kandugna, as patient was having daha, we need to have a daha prashamana dravyas. In all these Dushivisha, Bilvadiyagala, and Kalyanaka Mahatiktaka Gruta, Patola Katurehanyadi, all these Vishagna, Varnya, Daha Prasada, Kandugna properties were present. That's why patient have reduced the clinical features effectively in this Vicharchika patient. Thus, both Vicharchika, not only by the Virechana, all followed by Shamanaushadis, patient got benefited and reduced the all clinical features. This image or this slide shows about the comparison of both uh, grading along with photos of before and after treatment. I'll show once again the first slide also. You can observe in first slide we were observing over the griva, over the chest and over the arms and palpitial fossa, all Kandu, Ruja, Raji, everything was there. But after completion of 2 months, every complaints were um, gone. Okay, here this is the before and after treatment. We got complete relief from the whatever patient was having complaints. Coming to the conclusion, as atopic eczematous dermatitis can be correlated to Vicharchika in Ayurveda based on the symptoms which has been explained clearly by the Acharya Charaka and Shushruta. And in this case, probable cause of AD may be, means atopic eczematous dermatitis may be contact with the chemicals used in the form of fertilizers, pesticides in form, and this Dushivishari Gulika has given add-on benefit in relieving the clinical features over conventional Virechana and Shamanaushadis given in the Vicharchika patient. And this treatment can be studied in larger group of the patient also, as we are a researcher in academicians or a clinicians also. The in GP or in clinical practice, you can follow these line of treatment or Agada principles through like three sutras. We must have a Hetu Linga Aushada. We need to take a history of clear history from patient, then only we will complete the hetu, that is nidana. Linga, we need to have a knowledge of disease, then we need to have a knowledge of aushada, then only we can treat the patient more effectively. Thank you all. These are the parameters I took. I was saying about the grading. No, these are the parameters.
Thank you, Dr. Anjana. We
Thank you,
felt
ma'am.
as if we are really nowadays we
Actually, this is
usually.
very small one case, ma'am. Actually, I wanted to present more cases. I was busy in college. That's why I didn't do so many cases.
It's okay, Dr. Anjana, because even one case, when it is dealt in a proper manner and when it is exhibited in a proper manner, that is more than enough, what I
Yes,
feel. Because
yes,
nowadays we don't usually go according to our principles. We just randomly see the case, we over just overlook. Sometimes it happens, so we overlook, we don't take the case properly. So